This is Alex and Anna. They're planning to be new parents. Anna is 33 weeks along, and the couple is beginning to think about the process of childbirth and what is to come after. They have just found out their baby is a boy.
Well, that went well.
That was exciting, hey?
I'm so
Holy cow. Look at the little guy. Oh my god.
I'm so happy it's a boy.
Thank you.
It's
Me
like I knew
too.
the whole time that it was a boy.
You just had
I
that
know,
feeling,
you knew
eh?
that I knew that, yeah.
Yeah.
So awesome. Well, we can get him circumcised for sure, obviously.
Well, why would you want to circumcise him?
Well, because, like, my whole family, you know, my dad, my brothers, in our culture, like, they all got circumcised, right? Our whole family did.
Yeah, well, all my family's uncircumcised and they're just fine.
Yeah, I know they're going to be fine, but, like...
Well, what about all the pain it's going to cause him?
Oh my... Pain. He's a baby. He's not going to realize the pain. He's not going to feel pain. Come on.
Babies must feel pain.
Okay, he'll feel pain, but you know what I mean? Like, it's not something the baby's going to remember. I got my ears pierced when I was a baby, and...
I know, but
Yeah.
I don't know. At the time, I feel like it would cause him some discomfort.
Well,
and
the
stuff.
biggest reason for me is, you know, like, in our Jewish culture, like, everybody is circumcised in my family, and they're really big on that, and, you know, it's just, I feel like my family would care more. I mean, I just assumed that we would do that, because it's a norm for us.
I mean, we can always check out the different, you know, risks and stuff involved with it, and then make a
think we should.
decision. So,
Yeah.
do you want to like call someone and maybe talk about it some more? Or?
The public health nurse.
Oh
We can do that.
She gave me a card, I thought.
It's right there, actually.
Oh yeah, there it is.
Yes.
Awesome. Okay,
Okay.
I'll just give her a call real quick and see if we can get an appointment.
Okay.
He's so cute. Hello.
Alright guys, so how's everything going with the pregnancy?
It's going really, really good.
Good,
Yeah.
good.
You're just a little tired.
Yeah, I feel tired, but it's expected, right?
Right, yeah, of course, of course. Everything else is going well. Are there any issues or anything?
A little bit of issue.
Okay.
We're kind of conflicted.
Yeah.
We don't know if we want to get Johnny circumcised or not. We are having trouble deciding.
Okay, so how about we just talk about maybe why each of you might want to go one way or the other?
Well, for me, I do want to get him circumcised. In my Jewish culture, our whole family, all the boys in my family, my dad, they're all circumcised. So, I mean, it's important to my family, and I feel like they're all right. So, that's why, mostly. But,
And I respect that. It's her culture. I want her to be able to, you know, continue on that culture. But at the same time, I just don't see it as a necessary procedure. It's painful, and it's like the recovery time can be tough on the little guy, and it seems unnecessary to me. And why can't he make his own decisions, right? Like when he gets older, if he wants to be circumcised, he can get himself circumcised, and it can be his decision instead of us making it for him.
Those are great points, and I mean, it is a tough decision to make for sure. So within Canada, it can be done. There are private doctors who will do it, and it's paid for privately. It actually isn't covered by insurance. It's not something that the Canadian Pediatric Society and Canadian hospitals are recommending or engaging in, but it is definitely something we'll support you if that is the way you guys decide to go. It's kind of been shown that the benefits and the risks are even, so that's why they haven't exactly said, like, okay, like, we should do this or we absolutely shouldn't. They're just kind of neutral. So maybe we could discuss some potential benefits to circumcision.
That'd be good. We need to know that.
Yeah, so one big thing with the newborns is it actually will prevent UTIs, so the urinary tract infections, which is very important. It's very common with babies in the first few months, so it can be a big decrease. The other thing is that later in life, or when they're younger, it actually can prevent the contraction of HIV as well as HPV. And HPV is an STI, a sexually transmitted infection, that can lead to cancer. So it actually decreases the risk of penile cancer as well as cervical cancer for female partners. So it's kind of conflicting whether or not it helps with other STIs and it helps decrease that risk. However, it has been shown to do that in some studies, so it definitely could be a potential benefit. However, there are risks associated with it as well. So it's definitely important to consider. Obviously, one major thing we're concerned about is any pain that your baby might be feeling. So there is pain control during the procedure, of course. However, after, a lot of infants do experience that pain, the post-procedural pain.
Okay.
So, and it actually can later in life influence their pain levels, so they actually read like higher pain levels later in life, like during immunizations. It's been proven.
Oh wow.
So it's something to consider. I mean, it's a loose tie, but it is something to consider for sure. The other thing, it's very rare, but there can be infection and bleeding after the procedure. So that's definitely something you want to be aware of. Yeah, it is a little scary, but that's kind of a rare one. The most common complication would be meatal stenosis. So that's actually when the urethra, so like the hole in the penis, that's when that actually starts to close over. And sometimes babies will have to have a surgery to kind of have that opened up to dilate that.
Okay.
So that happens in about 2% to 10% of cases. So I mean, that's still a relatively low number, but definitely one of the bigger complications that you need to be aware of. Everything else is kind of lower rates. There are lower risk complications. However, they are still there. So, so I hope that, I know it's a lot to take in. I hope that it kind of provides a little bit more insight and some information so you guys can make a decision.
I mean, I don't want Johnny to be in pain or anything, so I mean, I have
sure.
no idea that it could be that, it could be like that.
Yeah, we'll definitely have to talk about it, but I'm sure we'll come to it.
I think we'll figure it out for sure. We will.
Okay, and if you guys need any more information, don't hesitate to call me. In the hospital, we'll be able to help you out, get you the resources you need. They won't actually do the procedure while you're in the hospital, but later after the birth, if that's something you decide, then we'll help you out with it for sure.
Oh, thank you so
Okay,
much.
so good luck with everything else, and we'll see you later.
Thank you.